this is not a mental health, it can lead to a mental health issue, but it is not in and of itself a mental health problem. And so I had to keep reminding myself of that, that even though it's in my head, it's not in my head.
Today we're here with Kim, who has a story to share about tinnitus. Kim, I'm going to start by asking you some rapid fire questions, okay? Could you first give us an explanation of what were your symptoms? What exactly did you hear when this was at its worst?
So when it was at its worst, and it was only in my left ear, and I heard a constant ringing, buzzing, static sound, and it would fluctuate. It wasn't always ringing, always buzzing, or always static, but there was always something there that was very distracting, very loud. I would say on a scale of 1 to 10, probably about a 7 or an 8, and was not something that I could control, which was very anxiety producing for me.
Wow, okay. And did you see any doctors for this? What kind of results were discovered, or what did the doctors have to say?
Absolutely. So initially, how this all started, I can kind of give you the genesis of it. I had a flu in about mid-January of this year. The flu resolved itself, but left a middle ear infection in its wake, and that manifested as muffled hearing in my left ear and a pain. So I went to urgent care as soon as I had those symptoms. And sure enough, they diagnosed me with otitis media, so middle ear infection, and gave me some antibiotics. I would say within 24 hours of taking the antibiotics, the main symptoms, which was the pain and the discomfort, had completely resolved. But I still had the muffled sound, and they said, okay, this is going to go on as the infection resolves itself. Expect that you'll feel this way for a couple of weeks. And then slowly but surely that started to resolve. I went back for a follow-up appointment with the same urgent care. I'm in Chicago, so this was Northwestern affiliated. And they took a look at my ear and they said, well, the infection's completely gone. But what you have now is something called effusion, which is a fluid buildup in the middle ear. And it's going to take another couple of weeks for that to resolve. And in the meantime, they gave me some allergy medication, some steroids to spray into my nose to shrink the nasal passages so that the water, the fluid that had built up in my ear would come out. So I was using that religiously. They had given me some oral steroids to take. I was using those. But the muffled sound then morphed into what we're now referring to as the tinnitus, which was the constant ringing,
Okay. Okay.
buzzing.
All right. So you're the type of patient who definitely had something physiological or physical in the ear system
Yes.
that caused a change. And then kind of after that, or near the tail end of that, the symptom of tinnitus developed. Now, for a lot of our patients, what we see is that, we're hopeful that we're trying to solve all the problems so that there is nothing and everything's back to normal. But sometimes the physiological, physical structures can heal, but this tinnitus can linger. This neurological tinnitus is still there. So, talk to us about how did this impact your life? What do you do for work? And what kind of hobbies do you have? Or what do you like to do? And how did the tinnitus impact your daily life?
So I'm a lawyer by trade. I've been practicing for close to 25 years. It's amazing for me to say that because I consider it still to be practicing because I haven't gotten it right yet. But I do business litigation. So I'm in court almost every day. And so I would say from that perspective, it presented some really significant challenges. I can actually remember quite vividly going into court and having to argue a motion, and I could barely hear what the judge was asking me, the questions that the judge was asking me over the tinnitus. And likewise, I could barely hear my own voice enunciating and presenting and projecting the arguments over the tinnitus. And it was so distracting that, I made it through and actually was able to manage to get some pretty good results through the court hearing. But I remember just being so anxious and depressed afterwards because I thought, if this is going to be the rest of my life, how am I going to be able to perform at a high level in my job with this condition constantly distracting me? As far as hobbies go, I enjoy sports. I'm on a softball team, but mostly I enjoy the spectator aspect of the sports. So I'm a huge Chicago White Sox fan, huge Chicago Bears fan. I do occasionally watch the Blackhawks, although I wouldn't consider myself to be as big a fan of hockey or basketball for the Bulls as I am the Bears and the White Sox. And my husband and I enjoy going to games all the time. So that was another factor for me to be in a crowd of people trying to deal with the ambient noise and trying to focus on what was going on in the field while this constant show was going on in my ear that nobody else could hear but me.
Wow. Well, clearly has a big impact on your life. Now, as a lawyer, have you ever dealt with an injury case that had ear symptoms or anything like that?
I haven't personally had that come up, but I am certainly aware as I do frequent research for issues that come up in my practice, which mainly focuses on business disputes, so breach of
Got it.
contract, shareholder disputes, things of that nature. But I do occasionally come across personal injury cases where there's been some injury to some of the essential function, whether it be hearing or speaking or being able to perambulate. So I'm aware of how impactful that can be on quality of life and how you measure those types of damages.
Yeah, definitely. Yeah, tinnitus can be caused by motor vehicle accidents. It can be caused by accidents at work, workers' compensation cases. So just wanted to bring that in case anyone listening was relating to that. Well, let's get back to your story here. So, um, what was the amount of time that you were really struggling with this before you eventually got connected to my team at Treble Health and you started working with us for treatment? How much time was this at its worst before you got help?
I would say it was at its worst probably for a good 2 weeks before I found Treble Health, and thank God I did, because the entire malady, I would say from its beginning, was about 4 weeks, because that's when I came down with the ear infection, which then morphed into the tinnitus. When it finally resolved and the fluid resolved itself, I was left with the tinnitus in its wake. So, I would say at the time that all of those other symptoms had resolved and I was just dealing with the tinnitus on its own, it was about a good 2 week period. And the reason I found you was because I started to consume every piece of information I could possibly find on the internet, in YouTube, in order to educate myself as to how to deal with this, coping mechanisms.
Yeah. Well, that's interesting
This-
because in some ways, as in your profession, lawyers are like professional researchers and able to judge what is truth, what is not, what is credible, what is not. So, how did you approach that research process, and what did you find?
Yeah, great question. So as we all know, you can't always trust everything you read and see on the internet. There's often a lot of fear mongering going on there, and you don't know what the credible sources are and what they're not. So I usually make sure that when I'm doing my research relating to a medical issue, I confine it to really credible websites like WebMD or National Institute of Health, something of that nature, as opposed to going on random chat sites where you've got people that may be filtering in information that's not all that reliable, or there's a hidden agenda there that
And there are some very popular, forums and chat Reddit tinnitus talk in the tinnitus community. And I think like about 10% of those conversations are generative and helpful and like creating hope. But unfortunately, I think a majority of them are individuals who are really suffering and are kind of bouncing ideas off of each other. So it might not be the best place, just a word of caution. So yeah, what else did you find, Kim?
So when I went on YouTube, that was ultimately what led me to you. And the reason that I was looking on YouTube was because I wanted to find something that I could play in the background, a soundtrack that would enable me to work. And I found your sound therapy video clips, and it would say 10 hours of uninterrupted sound therapy, whether it be crickets or water trickling down through a brook. And I got hooked on those, and I would literally, I'm in my office now, I would literally sit here at my computer with that playing in the background. And how it helped me was it enabled me to take my mind off of the tinnitus so I could then refocus my intellectual energies on the task at hand, whether it be drafting a brief or responding to emotion or responding to the hundreds of emails I get every day from clients and opposing counsel and the court. So that's ultimately what led me to you. And then I started seeing more and more video clips and other information from Treble Health, including I think you had one that was extremely educational, which was top 8 facts that you should know about tinnitus. And you talked about a recent seminar that you had gone to with where one of your mentors was presenting. And the one that struck me the most was, this is not a mental health. It can lead to a mental health issue, but it is not in and of itself a mental health problem. And so I had to keep reminding myself of that even though it's in my head, it's not in my head. And I found that to be extremely helpful. And then also your strategies for, again, coping and treatment and the hope that this can both get better and also that you can live a very active, productive, meaningful life and do all of the things that you're used to doing, even with this condition.
Okay, so you did get connected with us. You said,
I
"Hey, these
did.
videos are helpful. Maybe these guys can help me."
Mhm.
We ended up deciding, "Hey, let's work together." What
Yes.
did that look like, and what kind of tools actually did help move the needle? I want folks who are listening just to see what they can learn from your story. It might not be work with our team, and for a majority of people, it won't be. But maybe they can take bits and pieces that they can use to get relief or get a treatment in place with a different provider, or even do some things on their own to get help.
I remember it was bright and early Monday morning. I reached out. I took the information off of the YouTube, and I reached out over email. And I would say literally, this was what was most impressive and most comforting for me. It's not that I had to wait even an hour. I would say literally within a 5 to 10 minute time frame of me making that initial outreach, somebody from Treble Health contacted me and wanted to set up an initial screening. So that Monday morning, I probably spent about an hour between the initial Treble Health screener, and then I believe it was your brother that I talked to after that, and he was wonderful and was very reassuring. And
For those
then
who don't know, my brother Garrett is also an audiologist, and him and I run Treble Health together. So we have the family business thing going on. We have the family of doctors. We have a good time together. So Kim, as you were saying.
yeah, no, it was wonderful. And I described to him, I took him through step by step my story, and he was very helpful, both, as I mentioned, in being calm and composed and reassuring, but also giving me a lot of information and education. And that's what I thrive off of, because if I can understand what's happening to me, then I feel like I have some measure of control over it. And that does a lot to try to calm my anxiety down. because when you're in a flux, in a swirl, it's very difficult to figure out a plan and see that this is actually something that is manageable. So he was wonderful at that. And then he introduced me to the package and explained what that would consist of, the hearing devices, and made sure that I, was economically feasible for me to do it, which fortunately it was. And then set me up with an audiologist, which was Dr. Brianne Schwartz, and she was fantastic.
Amazing. So what did you work on with Dr. Brienne? What kind of tools or techniques do you feel like in your perspective actually helped reduce your tinnitus over time?
So one thing that Dr. Brianne emphasized with me was you need to be in a sound-rich environment all the time while you're dealing with tinnitus. My problem, and that she rightfully pointed out, I think something that I was doing wrong was I was constantly checking in with it, right? Because I sort of in the back of my mind felt like, okay, this is still a remnant from the ear infection, the flu, the buildup of fluid or whatever. And it could just be, it'll resolve itself instantly, like magic. So I constantly found myself checking in. Oh, is it still here? Is it still here? What about now? Is it still here? An hour later. Oh, let me check it. Is it still here? She said, stop, stop doing that. Because when you're checking in to see if it's there or it's not there, now you're bringing it to the forefront of your mind. And what we want to try to do is move it to the background. And that's the key to helping habituate to it. So just that little bit of information and helping me to shift my focus so that I would catch myself, because I would literally sit there doing like this. Can I hear it now? Can I hear it now? Um,
I've worked with some patients who tell me that they've done a similar thing where they might go into the closet of their bedroom where it's the quietest in their house and they would say,
yes.
"How is my tinnitus today?"
Yes. And that's the worst thing you could possibly do. So she disabused me of that entire practice. And she also trained me on the breathing methods. And she sent me a flyer, I believe, which was um, things that you can do. I have a dog, and so I often go out walking my dog, and she's wonderful. She's the love of my life. So she said, when you're outside walking Sadie, here are the things I want you to do. I want you to see 5 things. I want you to listen to 4 things. I want you to smell 3 things, none of which has anything to do with your tinnitus. And so the purpose of that, again, I think was to try to distract myself so that I'm not constantly focusing on the tinnitus and I'm focusing on other sensory things in my environment. But also to show me life is still good. All of the things you did before when you would go out on walks with Sadie and you would take her in the grass and smell the grass and watch her roll around in it, or breathe the air or walk in the sunlight. All of that is still there. It was there before you had the tinnitus and it's there after you have the tinnitus.
Talk to us about the volume, the perceived volume of what you went through, the intensity of the symptoms. You shared in the courtroom, you could barely hear the judge. So it's an intense, sound there. It's pretty loud.
Yeah.
How did that shift or change over time?
So over time, it got much quieter. And I think it was probably a combination of me, again, not concentrating so hard and so long and so much on it so that it was consuming my every thought. And also using the devices. I mean, I can't say enough about that because then what I started to do was shift from having the sound therapy YouTube soundtrack bit playing in the background to having these from the moment I wake up in the morning, as soon as I turn on my computer and start to go through my email, these are it.
So what
And
are those for people who don't know? And I think it's helpful to hear from you, someone who's actually used them with no previous thought about tinnitus or ears. What are those and how do they really work?
So these are essentially the hearing devices that they're very comfortable. You place them in your ear. So this is red for the right ear and blue for the left ear. So you curve them around like this. Nobody else can see them, especially women with long hair or people with glasses. They just sort of hide behind here. And unless you point them out, nobody really notices that they're there. And they are playing in the background a relaxing, soothing tone. It can be beats. And what Dr. Schwartz ran through with me is several different options for the sound that was going to be emanating through the hearing devices. And I picked the one that I liked, or I think the top two or three that I liked the best. And I wanted ones that were very relaxing, not distracting, that could drown out the tinnitus to a certain degree. I know you're always supposed to keep the volume just below the level of the tinnitus, but I didn't want anything that was too intrusive. So I think I'm on relaxation 2, which is called Autumn, and it's just nice tones and bubbling in the background. I'll say when I first started using them, that was all I could hear. But the more I had them in and the longer I had them in, and I was really religious about using it at every time during my entire waking hours. I would sometimes fall asleep with them, actually. I would have them in for so long. Then I started to not even notice the music anymore. So if I could distract myself away from the music, I could certainly distract myself away from the tinnitus. And it's just, you just start to focus on everything else that's happening in your daily life.
And the interesting thing is that happens subconsciously. So you, Kim, did not decide to stop thinking about it. It's just, oh, I noticed, I'm spending less time thinking about it. So that's what, when we're talking about neuroplasticity and retraining the brain, what you just described is an effect or, an example of that.
100%.
Well, I'd love to hear any words of wisdom you have for someone who is struggling, dealing with a bothersome sound in their ears or their head, just from your experience and what you know now, any advice to folks who could use some hope or inspiration, or maybe just, very detailed, a detailed approach of what exactly they should do, just opening it up for you to share information that could help others.
Absolutely. No, I'm happy to do it. Because as someone who was in that situation just a couple of months ago, I mean, it only has been probably 4 or 5 months. And I feel like I'm in a completely different place than I was when I first started, a much, much better place. So my words of wisdom would be, don't ever give up, continue to educate yourself, don't ever lose hope. It does get better, even if it doesn't resolve itself completely. It gets so much better, and the most inhibiting thought is, oh my God, I'm going to have to live like this for the rest of my life, and it's going to be horrible, and all of the things that I previously enjoyed, I'm not going to be able to enjoy anymore, and my quality of life is going to be so diminished. Not true. Not true. Yes, like anything, it's a change. It's something new that's being introduced into your life. It's not pleasant initially, but you do get used to it. And with there is help out there. As you said, Dr. Ben, if you don't go through Treble Health, find help somewhere. If the hearing devices don't work for you, try something else. Try the breathing exercises. Try the sensory exercises that I described before. Constantly keep the sound therapy playing in the background. There is something out there that works for you. It's all trial and error, but it will get so much better to the point where you don't even realize that you have it anymore. And the only time you actually are thinking about it is if somebody asks you specifically about it, or you remind yourself, like I was doing, checking in. I'm like, oh, I wonder if my tinnitus is here today. But continued it to seek out help, and also realize, I think things like this, especially when they're invisible afflictions and conditions, you feel very isolated. You feel like there's nobody else in the world that is suffering the way you are or being impacted or affected the way you are. And that's just not true. I mean, get rid of those thoughts, that negative soundtrack completely, because obviously there are other people, many other people who have this, who have tinnitus, and they have it for various reasons that it appeared in their lives. And the fact that there is a whole genre of treatments and coping mechanisms and education on this particular condition is just empirical evidence that there's so many other people out there that are sharing what your experience. So don't ever feel alone, and make connections where you can, because sometimes just sharing your stories with other people can do a lot, can serve as a support system.
Well, guys, here's Kim, the lawyer who had some medical ear problems that led to tinnitus and is now doing so much better and helping us all out. So if this was helpful, go on YouTube and comment helpful. Thank you, Kim.
Yes.
And Kim, you're the best. Great to speak with you and hope to hear from you soon. Keep it up. And guys, if you're watching with us at Treble Health, make sure to know that you can reach out to a specialist from our team. We are here to help. So we'll put a link on the screen right now. If you'd like to book a consultation or get in touch, we're here to help you guys. Thanks so much.